Hello everyone, I'm Apurva and I'm a dental intern. Welcome to my YouTube channel. In this video, I'm going to tell you all about my oral surgery posting. As you know, पिछले महीने तक I was posted in oral surgery department. So in this video, I'm going to tell you कि हम oral surgery में क्या सीखते हैं, what we do, कौन से cases मैंने observe किए, कौन से cases मैंने assist किए, everything about oral surgery. So, my oral surgery posting it started on 15th May and lasted till 30th June. It was one of the most memorable yet one of the most intense posting. मुझे लगता है पूरे BDS के सारे डिपार्टमेंट्स लगाने के बाद भी I will say that oral surgery was the most intense kind of department. Actually, that department is not like other departments. वहाँ का पेस इज़ वेरी फास्ट. वहाँ पे कुछ भी स्लो नहीं है. लाइक व्हेन पीपल वॉक they actually don't walk there. मतलब kind of they are running all the time. So it's not a slow paced department. You don't have a entire day to think and to do God knows what. Everything is fast there. So every day was different there. हमारा जो ड्यूटी होता था, it was divided into many parts like extractions, PGOPD, minor OT, major OT, ward and MRD. वहाँ पे we used to have OT days, ward days. Like अगर आप ward intern हो तो you have to go into the wards and you have to shift the patient for pre-op or for post-op or to the OT, everything like that. So, if you are a BDS student or you just want to know about oral surgery department, किस department में क्या होता है, then I guess this is the right video for you. So, let's not waste our time and let's get started. So, this was me just before my PhD department posting ended and my OS posting was about to begin. To be honest, I was really nervous. I had heard so many stories about the oral surgery department, like वो कितना hectic था and disciplined and how much work we had to do. So being an extern made me even more anxious because everything was going to new for me. Although our college officially started at 9 a.m., my day usually started much earlier. I would reach by 8:40 every day, and whenever I was posted as a ward intern or major OD case intern, I had to be there by 8 a.m., sometimes even earlier than that. In EXO, we basically examine the patient, we diagnose them, and if they required extraction, then we go for the extraction. Then there was the PZOPD, where more complicated and surgical cases were managed. We used to assist our PGs and we used to learn how they approach each cases. Another important part of posting was the minor OT. This is where the surgical extraction and disinfections were performed. Major OT days were completely different. If you were the ward intern, your responsibilities started with the ward rounds alongside the PGs and faculties. We shift patients, we help with pre operative photographs, we will assist with dressings, like that work. Uh, if you are a major OT case intern, you had the opportunity to shift the patient to the operation theater OT and observe the entire surgery closely, document the case with the photograph. Watching these surgeries was honestly one of the most exciting part of this posting. There were hectic days, long hours, and yes, we did get scolded too. But looking back, I understand that every correction was part of the learning process. I was also an extern in the department, so everything was completely new for me. The hospital, department, ward, people, work, and the expectations. It took time to adjust. I made mistakes, questioned myself many times, and often wondered that if I was doing things the right way. But that's exactly how learning happens. I even got the opportunity to attend casualty cases, which gave me exposure to the situations I had never experienced before. One thing that I couldn't experience completely was the night casualty. Since I lived quite far from the college, it was almost impossible for me to reach the hospital at 11 p.m. or 2 a.m. or even 4 a.m. whenever emergency calls came. I honestly wish I could have attended those cases because they provide a complete different learning experience. Initially, I felt like that I was missing out, but I also realized that internship is much more than just one duty or one posting. So I made the most of every opportunity I did get. Most days I did not leave the department until after 6:30 p.m. But if I was posted as a ward intern, I guess I used to leave after 7:30 around 8 p.m. Somewhere during the those weeks, I lost around 3.5 kgs. My breakfast and lunch schedule was a complete mess. There were days when I barely had the time to eat properly, and by the time I used to reach home, I was so physically exhausted that I didn't even have the energy to step out and get myself a dinner. What made this posting special wasn't just the work, it was the people. Our PGs were incredibly supportive, they were kind to us, our faculties guided us patiently, and the entire department created an environment where we were encouraged to learn and improve every single day. By the end of the posting, I wasn't the same person who walked in on the first day. So, if you are starting your oral surgery posting and you are feeling nervous, remember this: it's completely okay to make mistakes and don't be afraid of them. Ask questions, observe carefully, work sincerely, and keep learning every day. Because in the end, all's well that ends well. And just like that, my oral surgery posting came to an end. I will always be grateful for everything I learned because one day you will look back and realize that the posting you were most afraid of became one of your favorite memories. So, thank you so much for watching. If you enjoyed coming along on this journey, don't forget to like, comment, and subscribe. I will see you in my next vlog. Until then, take care and keep learning. Bye.